changes of the schedule that we had. So it's actually per request by Dean Rodevic, no, that we move our class on the afternoon because of an activity this morning, no, with some of your classmates. Well, anyway, let me continue sharing my slides, no, the one that we stopped last week. No? So kindly PM me if mawala yung signal. So I'm not using a video anymore, so that we won't have difficulties, no, for my signal on my part. Okay, so let me share my screen. Okay, so we ended up dito tayo na cut off last meeting, no, regarding a continuation of the complications of dental implants, no. So let's continue. Now let's continue our lecture. Okay. So one of the things, no, one of the things that we really need to look into if there would be an unhealing wound na tinatawag is actually the compromised wound. No? So when you say a compromised wound, it's actually a wound healing. No? It's a wound that fails to follow the normal sequence of events. So it means that it's something that did not heal, no? Because remember, in wound healing, in the patterns of wound healing, we have different stages. No? We have different stages of the wound healing pattern, which is number one, inflammation, proliferation, and of course, remodeling. So compromised wounds, no, happen at the stage of inflammation. Okay, so that's why, no, so that's why it's called a compromised wound. So basically, it happens, no, because of the presence of bacteria that results in the generation of exudates. No, it actually produces, no, the bacteria are the ones that produces the pus, no, or the serous fluid that contained within the compromised wound. So it contains, no, undisordered cytokines and So apologies, nawala ako ulit. No? Nag-drop ang signal ko. Okay, so let's continue. Okay, can you guys see my screen? Can
Yes,
someone confirm if
Yes,
they can
Doc.
see my screen?
Yes.
Hello? Can you
Yes,
see my
Doc.
screen? Okay, so let's continue. So there are
Yes po,
two.
Doc.
Okay,
We can
thank you
see your
guys.
screen.
Okay, thank you guys. So there is also manifestations, no, clinical manifestations of a disturbed wound healing. So those are number one, excessive bleeding. Now, if there would be excessive bleeding on the area, it would cause no disturbed wound healing, absence of a blood clot formation. Ibig sabihin, either there would be issues no on the intrinsic and the extrinsic properties of the blood, no. So ibig sabihin, either the platelets would be is not aggregating, or there's no coagulation of your blood, no? And of course, formation of granuloma, which is actually a sign of an infection, sinus polyps, no? And of course, fistula as a sign of a chronic wound, and of course, wound descents or opening up of your surgical area, and of course, ulcerations. So there would also be perforations, there would be wound necrosis, so there would be also flap necrosis, there would be pus formation, there would be chronic infections, there would be keloid formation or scarring no, towards the area. There would also be fibrosis. When you say fibrosis, non-elasticity of the muscles that would produce no, a sequela called trismus. No? So those are the clinical manifestations of a disturbed wound healing. Now, what are the clinical signs no, of a compromised wound? Number one, there would be a persistent inflammation for longer than 7 days. No? Ibig sabihin, there's no concerns already, no, bakit siya mamamaga or bakit siya mag-inflame. But basically, it's because the wound is not healing. So there would be malodorous wounds, there would be increased exudates, there would be delayed epithelialization, there would be maceration of the surrounding skin, there would be wound descents, and of course, there would be necrotic tissues. Okay? So these compromised wounds no happens because number one of an issue of the surgical procedure. So either the surgical procedure is not clean enough, or there would be violations. There would be violations on the principles of surgeries, no, and that would develop into a compromised wound. And because of the issues of compromised wound, get into a post-operative infection. So all of this particularly is an issue of what we call an asepsis. No? Asepsis would always be the issue. So ibig sabihin, asepsis on the surgical procedure is very important. Asepsis is also a concern of the compromised wound. And of course, asepsis also is an issue of the post-operative infection. So that's why we really need to manage the infection within those compromised wounds. So there are two issues on how we should manage infections no, on the compromised wound. Number one, the post-operative concern, and of course, the recurrent. When you say recurrent, nawala na siya, tapos bumalik pa siya. No? So it's actually like a phoenix infection. Okay? So what are the manifestations of a post-operative infection? So number one is there would be pain, there would be swelling, there would be erythema, there would be a presence of purulence, and of course is progressively life-threatening. Okay? So for us to be able to manage those infections, no, we really need to know the microflora of the odontogenic infection. When you say microflora, it means that what are the bacteria present on the area of an odontogenic infection. So always remember that in odontogenic infections, no, the concern is there's the concern palagi is actually triggered by the normal oral flora. And when there's an odontogenic infection, if especially if it's swelling, no, my cellulitis is a polymicrobial. So it means that it's not only one bacteria that would trigger such infection. It would always be polymicrobial. Next, there would be an anaerobic composition. It means that there would be an aerobic strain, there would be anaerobic strains. No, but no commonly, no commonly, it's an aerobic gram-positive cocci if it's streptococci, which is commonly bipulpal. And of course, if it's periodontal in nature, it could be anaerobic gram-positive cocci, strep, peptostrep, gram-negative rods, and of course, gram-negative rods such as your Porphyromonas, Prevotella, and Fusobacterium. So basically, there are two concerns now of odontogenic infection. The aerobic, which is pulpal in origin, halimbawa may dental caries, no? Tapos nagkaroon ng periapical abscess, that's a strep. But if you're going to talk of a periodontal issue, it's actually anaerobic in nature, which is periodontal always. So how do we manage, such infections? First is use empirical therapy. When you say empirical, what is known to be effective? No? Ano ba yung effective sa anaerobic? Ano ba yung effective sa aerobic? And of course, you have to be familiar with loading doses. When you say loading dose, what is the initial dose and the therapeutic dose of that antibiotic to counteract the infection of the said bacteria? So commonly, by principle, the loading dose of antibiotics is always double the dose. So, for example, when you're talking amoxicillin, the loading dose in the initial therapeutic dose of amoxicillin is always 1 gram. Then, for you to achieve the total therapeutic effect of the drug, you have to prescribe every 8 hours after. So, basically, yung pinaka-unang dose, yun lang palagi ang double it up. Okay? And of course, you have to know the use narrowest spectrum of the drugs. No, so it is improper to use high end, no, or highly expensive, no, antibiotics. No, so you always start with the narrowest spectrum. And of course, use antibiotics with low adverse reactions. So antibiotics which would not cause any reactions on the area. And of course, proper route and doses. When you say proper route and doses, it means that if you think that the patient has an inability to open the mouth or swallow, so why prescribe an oral antibiotic or a parenteral antibiotic? So it's better to give something which is IV and of course IM, for you to be able to bypass the first pass effect of the drug. And of course, adequate period of time of the drug, of administration. It means that you have to give the whole therapeutic effect of the drug. So if you're going to give it for 3 days, then give it 3 days. If you're going to give it for 5 days, then give 5 days. No? So you should give adequate of period of time for the bacteria to manage or control the said infection. So if you think that you can actually prevent post-operative infection or post-operative healing, post-operative swelling, because through an antibiotic, nagkakamali kayo. Because antibiotics, especially when you prescribe it post-operatively, nag-exo kayo, nagbigay kayo ng antibiotic, it says here it does not contribute to better wound healing, less pain, or increased mouth opening, and could not prevent the cases of inflammatory problems after the surgery. And therefore, giving antibiotics, no, giving antibiotics after simple tooth extraction cannot provide any help at all, no. So ibig sabihin, walang use ng antibiotics on simple surgeries, no. But if you're going to give if you're going to do surgeries, no, with yung tipo mga 2 to 3 hours, no, then it's time that you give your antibiotics. But of course, there would be a strategy. Now, if there would be recurrent infections, no, especially on your surgery and of course implant cases, no, there is a way on how you manage it. No? So you perform incision and drainage. No? So IND is incision and drainage. Then you could perform gram stains and of course culture and sensitivity tests. So these two are what we call laboratory tests. No? Sa laboratory yan. And this one is actually the clinical approach. No? Incision and drainage. So when do you prescribe, no? When do you perform these three strategies, no, in managing an infection? So if the infection is rapidly spreading, if there would be post-operative infections, no, there would be infections that is not responsive to the antibiotics that you're giving, and there would be recurrent or phoenix infection, yeah, paulit-ulit, and of course, an immunocompromised patients. No, if your patients who is immunocompromised and would have palagay natin metabolic diseases such as diabetes and of course kidney and liver problems, no, then it's time that you give some antibiotics for that one. So immunosuppression or immunocompromised patients is a big issue regarding antibiotics. Now, sometimes if your antibiotics doesn't work, kahit anong binigay mo, gano'n nakadami, ilumampas na isang buwan, gano'n pa rin infection, gano'n pa rin swelling, you might want to consider that the infection is not brought about by a bacterial and pathogenic organism. It could be others. No? And of course, remember, there are three kinds of pathogenic organisms, no, in humans. No? Number one is, of course, your bacteria, then there's your fungal, and of course, there's viral. However, viral infections does not produce any swelling. So commonly there are two, which is bacterial and of course fungal. So that's why, no, the signs and symptoms of fungal infections, no, is actually mobility of the dental alveolar segment, buccal vestibule and palatal swelling. And when you take a panoramic radiograph or a periapical radiograph, no, there would be gross osteolysis or bone destruction towards the area. So where do you get, no? Where do you get fungal infections? So either the patients would have history of ventilatory support, matagal siya nasa hospital, no? Especially on the ICU. And of course, there is a recent tooth extraction or a surgical procedure that triggered, no, this fungal infection. So one of the two fungal infections that would greatly affect the oral cavity is what we call aspergillosis. No? Aspergillosis penetrates the mucous membrane and of course invades, no, small and medium blood vessels. So this is a perfect example of an aspergillosis. So it only affects again small and medium blood vessels. So basically, it affects the capillaries of your tissue. So that's why that's the reason why there would be plaques, no, or areas of necrosis, no, on the small and blood vessels that is present, no, on the marginal tissues of your gingiva. Now, when you take your fungal test, no, it would reveal on a microscope that there would be spindle shapes, no, spindle shaped entities, no, on your histopathological examination. Another type of fungal infection is what you call mucormycosis. Mucormycosis is very rare, no? It's fulminating. When you say fulminate, it's aggressive. And of course, it's opportunistic. Wala siyang pinipili, no? Fungal infection. So it commonly affects patients who are immunocompromised, yung mababang resistensya. So this is one case, no, of a patient wherein the patient underwent tooth extraction on an outreach program. So the patient had a tooth extraction on an outreach program in Albay, no, somewhere in Region 5, Bicol region. So nangyari, after 1 week, the surgical area or the extraction site does not heal. and of course there would be severe swelling. So after giving appropriate antibiotics for that one, after 1 week, bumalik yung pasyente with a swelling on the infraorbital region. So the dentist from Balbay, called me up and of course showed me a picture of the patient, and he told me, sabi niya, grabe daw yung infection, very aggressive. Now, as I see it, no, initially on this picture, no, wala pa yung scabbing on that area. I said, no, yes, it's actually a very opportunistic and aggressive pathogenic organism. However, bacterial infections or the bacterial pathogen does not go up to the infraorbital region. So that's why I requested the dentist to send me the patient immediately the next day. So the patient traveled from Bicol going to our clinic in UST. Then he showed us that there's already scabbing on the area. There's already scabbing or necrosis of the inferior palpebral area or the infraorbital area. So I asked an ophthalmologist friend not to check on the mobility and of course function of the eye of the patient. So he's told me that it's basically a very aggressive infection, and we are only given a 3-hour window for the patient to be able to see and for us to be able to save the eye on the right side. So that's why we posted immediately an irrigation and debridement, in the operating room. Then I open up, this area, this Cadwell lock area. So I open it up in the premolar, and pus came out towards that area. I also performed inferior palpebral drainage, of the lower eyelid of the eye. So basically, you could see that there is an exudate or pus coming from the area of swelling. So immediately the next day, the patient was okay, and of course, the patient can actually see and of course open his eyes. Now, however, one concern that was brought to me is that when we took the culture, this exudate, when we took the culture, it turned out negative. Negative siya from any bacterial culture. So that's why it's a protocol, by the infectious diseases department of our hospital, that if on the culture it did not show any issues of concerns regarding bacteria, so they would actually test it on a fungal infection. So it turned out that the fungal infection was actually mucormycosis. Now remember, I said that mucormycosis affects immunocompromised patients. No? So that's why we tested the patient now, and one of the tests that was given was actually ELISA testing. ELISA, ELISA. So ELISA test is actually meant for patients who are immunocompromised and of course who are HIV positives. So after a few days, the ELISA test came out, and it turned out the patient was actually positive, with HIV. So basically, if you see the rundown of the events, ang tanong ko ngayon, saan ba nanggaling ang pasyente? So the patient came from a outreach program, and you use as instruments, instruments for that patient, and the instruments were not properly sterilized, through pressure sterilization or through your autoclave. That would kill the pathogenic organism brought about by the HIV. So basically, there would be already a spread on the HIV on that time of the outreach program. Okay, so kaya ayaw ko na nag-outreach program because of this one. So that's why we fabricate, we get fungal cultures. However, one of the concerns of fungal cultures is that they can also be carcinogenic, especially some families, or some strains of your fungi. They are actually carcinogenic. So that's why they sometimes produce oral cancers or head and neck cancers on these cases. Okay, so there would also be nerve injury. So when you say nerve injury, you have actually violated and injured a nerve on the jaw or on the oral cavity of the person. So nerve injury is caused by pressure, stretching, or cutting. So basically, it actually stops the signals, and from the brain causing the area to not work properly, and of course, the loss of the feeling on the injured area. So it depends, no? It depends upon the type of injury, if it's pressure, stretching, or cutting. Now, there are different kinds of classifications for nerve injuries, but the most common and the widely used is what we call the CDONS classification. So, see, it is important for us, no, for us to be able to uh, determine, no, the classification of the nerve injury, because the management, no, and the treatment protocol for each type of classification is different. Like for example, neuropraxia. When you say neuropraxia, is actually a mild injury, no, mild injury. So parang nag-elevate ka or naglagay ka ng dental implant on the bone, nakapatong yung dental implant mo on the inferior alveolar nerve or the mandibular canal, causing neuropraxia. Now, if you drill more, ano ba, nag-drill ka, tinamaan mo or na-perforate mo yung nerve, it becomes axonotmesis. If you drilled on the nerve, then cut the nerve, that's neurotmesis, no, na tinatawag. Now, I said a while
Hey,
ago that, mute please, as I've said a
also,
while ago, please mute. And of course, as I've said a while ago, that the recovery time and of course the protocol for management would depend, no, upon the type or classification of your nerve injury. Like for example, on neuropraxia, neuropraxias are sometimes self-limiting. Ibig sabihin, they are transient. Nawawala siya, and of course, bumabalik yung sensation. However, the time for you to observe, no, the return of the sensation would be around 1 to 2 weeks. No? After 1 to 2 weeks, tapos hindi pa siya nag-return into normalcy, what you have promoted is what we call axonotmesis. Now, axonotmesis is actually an injury to the nerve that would lose its sensation or function within 6 months' time. So kung halimbawa, 6 months na manhid pa rin, then basically, you have neuropraxia. And there's also what you call neurotmesis. When you say neurotmesis, you promoted a severe injury towards the nerve. You have serrated the nerve. So basically, no, neurotmesis, no, sometimes no, does not recover at all, and sometimes they do recover at all. So it's very hard, no, it's very hard to determine the degree of paresthesia is if you're going to wait for time. So that's why, no, what I recommend, no, is for you to be able to prevent, no, such nerve injuries. So if you have a panoramic radiograph and it presents that on your surgical area that that the nerve, no, is actually towards that area, then you have to take in what we call a cone beam CT scan, a CT scan for dentistry. Now there you would be able to localize and of course identify, no, and then identify the mandibular canal, no, and of course the iyan, no, tinatawag, okay? And from there you would tend to be cautious and you would be able to tell the patient that there's a probability na matamaan talaga yung nerve. Okay? So how do you manage? No, how do you manage those paresthesia? So basically, you have what we call transient recovery. Wala kang gagawin, paghintayin mo lang siya, after a few weeks, sabihin niya, manhid pa rin or hindi na manhid. So basically, that's transient recovery. Then also, you have pharmacological management. Now, how do you do pharmacological management? Of course, you need to prescribe vitamin B complex, no? So 500 milligrams, and of course, vitamin E's. Now, how do you give it? No. So basically, you don't need to wait. No, you don't need to wait to confirm what classification of analgesic do you have. No, so my payo or my advice to you is within if after the resolution of your anesthesia, no, tapos wala kang tapos manhid pa rin, so that would happen around 2 to 3 hours the surgery. If there would be still numbness, no, then you could start asking the patients, no, please take your medications for us not to be able to produce certain complications. Okay? Then also you have microvascular surgeries, no? From the term microvasculars, no? Isipin mo yung dalawang nerve, pinagdikit mo. So basically, microvascular surgeries, no, especially for nerve injuries, is very complicated. Kasi mas maliit pa yung nerve compared to the artery and vein. So parang gabuhok na lang yung nerve that on that area. So these are the simple management of of the nerve injuries. Okay. So another complication is what we call bleeding or what we call hemorrhage. No, there is what you call a preoperative concern. There's also an intraoperative concern. And of course, there's would be a post-operative concern. When you say preoperative concern, it means that you did not fully diagnose your patients if they would have issues on antibiotics, allergies, no, and of course the medications that they're taking. Now, if you think that a certain medication would be an issue regarding healing, then basically what we do, we try to postpone the surgery itself. No? And there's also what you call intraoperative concerns. When you say intraoperative, it's actually based on the chairman uh, of the concern. No? So ibig sabihin, you have issues already, you have issues already on that area. So that's why you as the chairman or the pilot of the surgical procedure, you did not consider several issues such as anatomy, your principles of surgeries and everything. So it's an intraoperative concern of bleeding. Now, post-operative concern is if you did not manage the intraoperative bleeding, and plus nagkaroon ka na ng preoperative concerns. So basically, post-operative concerns, it's something that would really give pressure to the dentist and of course to the pilot of the surgical team. So basically, there are several ways on how you manage bleeding on the patients. You have what we call, of course, cautery or lasers. No? You would have stitches. You would have pressure packs, and of course, cautery or coagulation. But if the bleeding is towards the bone, no, so you could put in bone wax or paraffin waxes. And if you would have issues naman on the tissue bleeding, then you have what we call your Surgicel or absorbable hemostatic agents. No? So basically, these are the strategies and of course the risk factors on the on the intraoperative, postoperative, and of course preoperative concerns of bleeding. Now, when you say before, ibig sabihin preoperative, your concern of bleeding would always be systemic. It would be congenital or acquired, or if the patient is taking up anticoagulants and of course antiplatelets. During, it means that it's intraoperative on the procedure. It involves traumatic surgeries, soft tissue lacerations, large vessel damage, and of course, oroantral communications. There would be also afters, or post-operative, which concerns us on infection, physical trauma, and of course, failure, to, to post-op instruction. So basically, these are the risk factors on each, of the phases of of the bleeding or hemostasis. Okay. Now, when you say systemic factors, it could be any of the following. It means that it's because of the body. Either the patient is hemophiliac or the patients would have von Willebrand disease. And of course, there would be also drug-related abnormalities such as, of course, your induced coagulation abnormalities and of course, your platelet abnormalities. Okay. Now, when you concern on the local factors, these are the issues that you need to look into. Number one, surgical anatomy, and of course, is variations, because not all anatomies, would be the same from one another. So, halimbawa, yung katabi nyo, hindi kayo pareho ng anatomy yan. There would be changes, There would be changes, of course, and of course, improvements, And of course, trauma on the surgical site, when you're performing surgeries, wagas na wagas ang pagre-retract nyo. So more so, remember that if you're doing dental implants, it's something that you don't want to do palagi. You really have, to be careful in in managing your flaps, managing your incisions, reflecting it, no, because of course tissue trauma is a concern. Next, you have what we call patient's compliance. No, patient's compliance means sinabihan mo, okay, mag-toothbrush ka. Bumalik sa'yo after 7 days, ang baho-baho ng hininga. Why? Kasi hindi siya nag-toothbrush. And of course, you have to inform the family no, na ganun ang nangyari because you really need patient's compliance, no? Remember on the concerns of medical doctors. So what we do, we usually, tell them ahead of time, okay, ganito mangyayari sa'yo, magkakaroon ka ng maga, magkakaroon ka ng sakit and everything. But you have to be ready, no? You have to be ready that sometimes patients are matigas ang ulo. And of course, there would be issues on the clinician skill and experience. So ibig sabihin, nagawa mo na lahat, pero kulang ka pa sa skill and of course, experience on that surgical procedure. So that's why if you think that you cannot perform the surgical procedure and you don't have enough skill, then don't perform it at all. You might bring in more complications rather than simple complications. So that's why they say, no, yet you have to train yourself more, no? Because if you don't train yourself more, if you don't study on a higher level, no, complications, no, are brought about by less likely skilled procedures, no? So that's why if you are not capable of doing the surgeries, might as well, no? You have to tell the patients ahead of time. Na sabihin mo, okay, first time ko to gagawin, so tulungan mo ko. Or hindi ko to kayang gawin, i-refer kita, no? Something like that. No? So you have to tell the patients ahead of time rather than pretending na magaling ka tapos hindi ka naman pala marunong. Okay? So you promote more complications. So what are the common areas of hemorrhage, no? In the oral cavity? So basically, this is a very least concern, no, in dental implants. But the most common, no, concern on bleeding is coming from an abnormality, no, of your inferior alveolar artery. So it would be coming from, there's a branch, no, there's an excess branch, no, of the inferior alveolar artery that goes into the distobuccal area of your lower third molars, no. So if you're going to remove, no, if you're going to remove bone on that area through odontectomies, you have to be ready that there's a possible abnormality on the area. So the bleeding would be very profuse, no, but you can actually control it through pressure. And on the anterior regions, no, this is actually a concern of dental implants, no, because I experienced one, no. I extracted tooth number 4-2 and of course 3-2, then put in a longer implant. Now, after that, no, after 24 hours, the patient called me up and there was actually a concern on hematoma on the floor of the mouth. No, ibig sabihin may pasak siya on the floor of the mouth. Now, basically, no, when I reviewed my radiographs, no, I found out that there's a terminal point there of your inferior alveolar nerve and nerve, artery, and vein towards that area. So I might have hit, no, the terminal point, no, of the inferior alveolar vein. No? So that's why nagkaroon ng hematoma. Okay. On the maxillary, there are two concerns, no, on bleeding that would be coming from the nasopalatine artery and vein on the lingual portion of your tooth number 1-1 and 2-1, and of course the greater palatine foramen, no, on the area of the tooth number 1-6 and of course 1-7. And these are hematomas, no, and of course ecchymosis. When you say hematoma, no, hematoma, it's actually brought about on the area of the surgical area. If it's ecchymosis, it's a little far, no, coming from the surgical area. So will you be concerned of hematoma? Initially, hematoma is not a big concern. However, if the hematoma becomes ecchymosis, no, it means that the bleeding point is spreading. So you have to find out the cause of the bleeding, and of course stop it, no, before it spreads out to other areas of the head and neck region. So that's why the best test, no, to check on the issues of bleeding is what you call the clotting time and of course the bleeding time. No? Here you will be able to see the effects, no, of your platelets, no, if you're doing clotting time. No? And of course bleeding time, you would also see here the effects of your red blood cells. No? So that's why these are the two basic tests. No? From these two tests, you would also see the effects of your aspirin na tinatawag or your salicylic acid, salicylic acids nyo that would be taking for to prevent thrombosis, to prevent heart attacks, no, on your patients. And if your patients are taking up Coumadin and warfarin, no, so the best test is actually the prothrombin time or the international normalized ratios. No? So if your patients are taking up Coumadin and warfarin, no, to control the coagulation time of your blood, no? Especially the extrinsic system. When you're going to perform surgery, you have to make sure that the levels of your INR would be around 2.0 to 3.0 on the level. Now, if it's 1.58 or 1.59, don't perform the surgery. If it's 3.1, don't perform the surgery because you would be going out, no, on the therapeutic and normal level of your Coumadin and of course your warfarin. Now, how do you manage hemorrhage? No? You have to put in pressure, no, direct pressure on the area using a gauze for 5 to 10 minutes. So moist gauze, pressure on the area for 5 to 10 minutes. Sometimes you need to put in gel foams and of course Surgicels for you to be able to promote and enhance the hemostatic effect of your area, no, towards that concern. And sometimes you could use locally acting hemostatic agents. No? One of the basic locally acting hemostatic agent is actually the epinephrine found on your local anesthesia, dun sa carpal nyo. So you could use that anesthesia fluid, no, to put it on a gauze, then put pressure, and that would actually stop some bleeding on that area. Or if you have big concerns on bleeding, you could use your tranexamic acid ampoules or vials. No? Either you inject it on the deltoid or you put it on a gauze, then pack it on the area. So there would also be deep sutures, clamps with clips or hemostats, electrocautery if you're using soft tissues, bone wax if you have bleeding in the bone, and of course sometimes you need to put in pressure dressings for you to be able to compress, no, the space on that surgical area. So there would also be issues of implant specific complications, and one of such, is actually an oroantral fistula or the insertion of your dental implants towards the maxillary sinus cavity. So the dentist was trying to put the implant here, no? And instead of during the drilling, no, okay pa siya, but after the patient drilled, no, and was trying to put in the implant, no, wala yung implant. So basically, the implant is there on the posterior part of your maxillary sinus. So if you have concerns of this someday, no, remember, nakalimutan ng dentist, that this classification of bone here is what we call D4. So malambot siya. So if you're going to do implant placement on the area, if you're going to drill, no, you have to cut off one drill lower. So ibig sabihin ko yung implant mo is 4.0 and instead of going for the 4.0 drill, you might want to go to the 3.5 or 3.75. One drill lower. Kasi malambot ang bone ng pasyente. And by screwing in your dental implants, no, it would promote, it would also loosening of the bone. Kasi nga, matigas ang implant, tapos sinuscrew mo siya, well, basically, bumahin lang si pasyente, papasok ang dental implant. So, you have to be careful with oroantral fistulas. And of course, there would be also fractured dental implants. No? So, this is a fractured dental implant, no, that was referred to me for retrieval, and this is the fractured side. Okay? So in conclusion, dental complications are rare by 1 to 10%, no, of daily clinical practice, and they may arise, no, because of the lack of knowledge and recognizing and, of course, managing potential problems. No? Is commonly brought about by any clinical procedure such as stress-provoking procedures and, of course, techniques. So it means that if your procedure is, medyo complicated, medyo matagal, stress-provoking siya, doon normally nagkakaroon ng complications. Why? Because pagod na yung dentista, stress na yung dentista, pati yung pasyente agitated na. So basically, no, if you want full control of your surgeries, no, lessen your surgical time, and of course, improve your skill and improve your attitude towards the surgical procedure. And of course, a medical history and a number of medication is very important for you to be able to check the profile, on the medical profile of your patients. And if your patients would be medically compromised, you have to lessen longer appointments. No, don't prescribe longer appointments on your medically compromised patients. It's better to do with them under general anesthesia if you're going to do them, no, na medyo marami kayong gagawin. And of course, what is important is the lack of skill and competency of the clinician and of course the dentist. So it means that if you don't know the procedure, study, train, or refer. No, there is no such thing as try in oral surgery and dental implants. Trying that should not exist, no, on surgeries and dental implants because there would be a high regard of concern and complications, no, if you said that you're just going to try. So with that, no, I leave you a quote from G.V. Black that the professional person has no right to be other than a continuous student. So with that, thank you everyone. Okay. So any questions? No? Any questions on the lecture? Any questions? Any questions on the lecture? Okay.
None,
so-
Doc.
Okay, sorry, hindi ako mapag-video, ang hina ng signal ko. Okay, so with that, no, I'm going to send my notes later this evening. When I'm settled down. No? So I'll send in the notes. No? So remember, your P3 exams would be next week. So I'll give I'll give you some notes for your P3 exams. No? For that. No? And of course, your final exams after 1 week. So let's meet. No, let's meet on the days now before we do have our final exams. Okay, so class mayors, please remind me of the notes, no? And of course pala, huwag niyo kalimutan, please take an attendance today. Okay, cameras on. Okay, cameras on. Okay, so E1 first. Okay, please tell me if you're okay na.
Okay na to.
Okay, E2. Okay, done.
Done, Doc.
Okay, so thank you everyone. Have a good day. Have a good day. Then please remind me of the notes. Okay, so ingat kayo and thank you so much. Ingat kayo.
Thank you, Doc.
Thank you everyone.
Thank you, Doc.
Okay, bye-bye.